to my channel. It's Dr. Alfred here again, and today I'm going to be doing something different. I'm going to be giving a health talk. Not doing skincare today. As you can see, I'm looking all glam. I don't know, I just felt like, let me do a little bit of makeup for this video, put on a wig. Not every time Simbi hairstyle, all back, we have to change up the look a bit. So that's why I'm looking like this today. If you're new to my channel, welcome. This is Dr. Alfred. On this channel I talk about skincare, beauty, lifestyle, and I also talk about health. So today I'm going to be talking about a very interesting topic that has been affecting our society. Let's say out of 10 patients that I see in a week, I can see like 7 patients complain about this particular illness, and it's really literally eating people up. So what am I talking about today? I'm talking about the notorious H pylori bacteria. Now, what is H pylori? Is a type of bacteria that affects the intestinal lining. It affects the stomach as well. It is contracted by eating infected food or drinking infected water. For example, someone that has H pylori bacteria, so the person is a carrier, the person prepares your food for you, maybe in a restaurant or in a buka or mama put, and then maybe, let's say the person is not hygienic enough to maybe wash their hands, or they don't wear gloves while making your food. This person can actually transmit this bacteria inside your food. Now you go, you pay your money, you buy this food, and then you see that open your mouth, wow, and eat this food. Guess what? H pylori is going straight down to your system. It's digested, it goes into your bloodstream, and then it spreads. This H pylori bacteria can cause what we call ulcer, stomach ulcers, and not just stomach ulcers, it can also cause duodenal ulcer. Now I know you're like, oh, you lost me there, doctor. Don't worry, I'm going to explain for you. Now, duodenum is the first part of the intestine. So we know that, of course, digestion starts from the mouth. From the mouth, we have the esophagus, which is the long pipe that goes from the mouth, connecting the mouth and the stomach. And now when the food goes down, of course, from the esophagus to the stomach, it then continues from the stomach to the intestine. That is basically the small and the large intestine. So there are different parts of the small and the large intestine. If we break it down, the small intestine is divided into the duodenum and the jejunum. Okay, so now this first part, which is called the duodenum, the H pylori bacteria can stay there and be causing you nuisance. What are these nuisance? I'm going to explain to you the symptoms that one can experience when they are infected with H pylori bacteria. Number 1, stomach pain. Hey, this person will be experiencing a lot of pain in the abdomen. They'll eat food, maybe they think they'll get some relief. They probably might, but then later on the pain starts again. Why? This bacteria, aside from weakening the lining of your stomach and intestine, it can cause what we call a wound. Now, this wound, of course, we have acids that help to digest the food in the body. Now imagine the stomach lining has been adapted. God made it in a way that it can withstand the acidity of the acids that will help you digest the food. When that lining, protective lining, is stripped away, these acids can act on the wound and cause you pain. That is what is causing the pain, the abdominal pain. Also, other things can affect this wound per se, like diet. For example, you're someone that likes to eat a lot of spicy food. Imagine you are pouring pepper on wound. You can imagine the pain. So that's basically what you're doing. Another symptom that one can experience when they are infected with H pylori bacteria is bloating. You notice that your stomach is always bloated. They are farting a lot because you're having a lot of gas. A person can show signs of nausea and vomiting. Nausea is the feeling of vomiting, but not actual vomiting. I've already talked about the sources of H pylori. It can be gotten from infected food and water. I've talked about the symptoms. Now I'm going to be talking about the diagnosis. How do we diagnose or to confirm that this person really has H pylori? Method of diagnosis is by doing a serum blood test, meaning you take a blood sample from the person from their vein, and then you test it in the lab and you see that, okay, this person has H pylori. But then how do we truly confirm that this person has a H pylori antigen? We ask for the patient to produce a stool sample. So yes, we actually give you a bottle and we ask you, please can you poop inside it? Not that you fill the bottle. Okay, I'm speaking now on behalf of all my lab scientists. They don't need all your poop. They just need just a tiny bit of the poop that you produce for us, and then they go ahead to test it in the lab and to see if H pylori antigen is present in your stool. Now, once that is confirmed, bam, you have H pylori. How do we go ahead to treat it? The treatment for H pylori is triple therapy. I almost said triple therapy. Okay, this triple therapy is a combination of course, 3 medications. We have 1 proton pump inhibitor, which basically is example like omeprazole. You may have heard the name going around. We have rabeprazole. Okay, we also have lansoprazole, but currently the guideline we're using now in Nigeria is rabeprazole as part of the triple therapy. So we have the 1 proton pump inhibitor, we have 2 antibiotics. Now, what are these antibiotics? The first one is tabbed amoxicillin. Okay, amoxicillin is part of this triple therapy, and the third one is what we call clarithromycin. Now, there are other suggestions for the other antibiotics that can be used in this triple therapy, but the current guideline that we're using, well, in my hospital, is clarithromycin and amoxicillin, and you have to take it for a period of 14 days. That is 2 weeks. I know many of you patients that don't like to take medication. Don't worry, we doctors, so we don't really like to take medication, but I mean, you have the problem. You are the one that have the problem, and you don't want to finish the course. What is the implication of not completing this medication? You've started the triple therapy and you are seeing progress. Now, after 5 days, your abdominal pain has stopped, your bloating has stopped. You're like, do I really need to complete this 14 days? Yes, you do have to complete the 14 days so as to clear these bacteria from your system. If you do not complete the 2-week course treatment, you're not going to clear the H pylori from your system. We have what we call complications. Complications are things that happen when a certain illness or disease is not properly treated or is not treated at all. It now progresses from symptoms to complications. Now, complications that can occur as a result of this H pylori being in your body is that it can lead to ulcers. Now, these ulcers can get deeper and deeper, so it will keep taking out the lining of your stomach, and eventually can lead to what we call a perforation. Now, a perforation is when there is an opening. It's just a perforation through an organ and creates a hole. That's a perforation. And when there's a perforation, there can be a possible bleeding. And now this is what we do not want, because this bleeding can lead to anemia. You tend to lose blood because you are vomiting blood. You are stooling blood because you refuse to treat this H pylori. Another complication that can occur is that the H pylori is a notorious bacteria for transforming ulcers into cancer. So it can actually cause duodenal cancer, cause gastric cancer. So this is why it's very important that I talk about this pandemonium, this catastrophe in the society, because I see a lot of people coming down with these symptoms, complain about it to me, from friends to families to patients. And so that's why I decided today I must talk about this. You notice that you've been having some of these symptoms, please go to any hospital or healthcare center near you, get yourself tested for H pylori, and if you do have it, is positive, please get treated for it, and avoid eating roadside foods like all this suya, akara, because you don't know who's preparing your food. If you must heat my food in the oven, like very well. I heat it very well so that if there's any germs at all or bacteria, it will kill it. Because sometimes you cannot avoid these things. Even me that I'm telling you, I cannot avoid it. I like akara, I like suya. But it's very, very important that we take care of our health, we take care of our diet, and also we stay healthy. Let me know if you've heard about H pylori before. I hope you enjoyed this video. Thank you for watching. This is Dr. Omam Alfred, and there's nobody like this at all. Don't mind me, I'm just feeling myself today because I mean, check me out. How about that? Thank you for watching my video. Please remember to like, comment, and subscribe, and see you in my next video. Bye.